Now that Dr. Boasso has dispelled some of those myths, we are going to chat about and address the issues of preventative measures and habits, that we can practice. And with me in Tobago, it's Dr. Roxanne Mitchell, who's the General Manager of Primary Care Services of the TRHA. With me as well is Sherry Ann Rollox Hackett, who's the School Supervisor 3, Division of Education, Innovation and Energy. Good morning and welcome.
Good morning.
Good morning.
Thank you.
Thank you for joining us this morning. Now, so the myths have been dispelled, and Dr. Boasso has put it across very, very eloquently. And, we want to get into the ways in which we address preventative measures and such, because Tobago has not yet recorded any cases. So it is key that, prevention be the main point right now. What are some of the measures that is being taken by the TRHA? And then we'll go into what measures the schools are taking in Tobago.
One of the general measures, as indicated by the government, would be to wash your hands with soap and water. Wash your hands after blowing your nose, discarding of your tissues properly. You ensure that you wash your hands with soap and water. We have been trying to push that information out to the general public. We have engaged not only the TRHA staff, but members of the general public with regard to these safety measures. Additionally, the Prime Minister would have indicated, as well as the Ministry of Health would have indicated, social distancing. We now have a limitation in terms of the numbers of persons that can gather. This will be in an effort to ensure that we do not transmit the virus from person to person. We are continuing to engage the public. We are continuing to engage members of the TRHA. We are continuing to engage the first responders with regard to a number of the preventative measures that we do have in place at present. We are hoping in the not too distant future to engage a hotline with regard to persons calling in to get information with regard to where do you go if you have these particular symptoms. What do you do if you present with fever, cough, and other respiratory symptoms? We are hoping before the week is out that will be in place for the island of Tobago.
Definitely. Now, it has been stated here that children tend to show very mild symptoms of the virus and can therefore be very efficient carriers of it and then spread it to their families as well. And schools being the places where children, the most children are gathered. From your seat as School Supervisor 3 in the Division of Education, Innovation and Energy, Sherry Ann Rollox Hackett, what is being done from that standpoint?
A pleasant good morning once again. As far as the schools are concerned, as the preventative measures, we would have engaged the students in a educational exercise, making them very aware of the COVID virus and how they can protect themselves and also members of their families. That's one of the reasons why at this point in time, we have our schools closed. But even before the closure, we were educating the young people and the students, and we were also ensuring that the proper method of washing hands and coughing and sneezing, all of these things will make known to the children at assembly by the various principals. In addition to that, we also put a ban on field trips. All foreign field trips at this point in time have ceased, also local field trips. Because as you rightly say, our young people, they are the ones who will tend to probably be carriers of, or to spread it, because they will not show the symptoms as the older folks or persons who have pre-existing conditions. So at this point in time, the students, even though they're at home, they are fully aware of how they can also protect themselves.
Definitely, definitely. And Dr. Roxanne Mitchell, when it comes to the phrase that we've been hearing, flattening the curve, what is being done by the TRHA to assist or to aid in that flattening of the curve? Although there are no cases in Tobago, what are some of the methods or protocols that are currently in place to ensure that if and when Tobago has its first case, that can be controlled to the greatest degree?
All right, so flattening the curve basically means you are controlling the rise in the disease process to ensure you can deal with the disease process adequately. It is based on the capacity of the TRHA to handle cases, positive cases of the coronavirus COVID-19 disease. Now, what we are looking at would be, one, ensuring that we have an efficient triage system at the hospital to ensure that we divert persons with respiratory symptoms, persons who may have a positive history with regard to COVID-19. We're also looking at setting up isolation areas as well as COVID management areas, whether it is within primary care or as an offshoot of the emergency department, ensuring that we do not have a clustering of persons at the hospital to overwhelm the resources currently present there.
All right.
Another part of that, of course, would be the social responsibility, personal responsibility with regard to persons not transmitting the disease from one to the other. And again, our advice with regard to washing your hands or advice with regard to not gathering in large groups, that would also help to lessen the spread of the disease and as such allow our healthcare sector to be able to deal with positive cases as they come in, thereby overall flattening the curve.
Excellent. And what is the general feeling of health practitioners in Tobago as pertains to the COVID-19 right now, them being the ones who would be the first responders and the ones who are the front line, so to say, as pertains to battling it should there be a case in Tobago?
As with every other country, as with the advent of any new disease, any new event, there is some apprehension. We are still working with staff to allay some of the fears. There are concerns. Persons do have personal concerns with regard to whether or not they will, if and when we do have a positive case, whether they will be transmitting the virus to their family members. We do have persons wondering whether or not they would be adequately prepared to deal with the particular individual or individuals that come in. So there are normal concerns that we're seeing globally and even within the public. We are trying from the THA standpoint, from the TRHA standpoint, to ensure that we have the adequate supply of personal protective equipment for staff. We are ensuring that we put our mechanisms in place to ensure we have a quick return in terms of testing of persons so that we can help to alleviate some of the fears that practitioners, first responders may have.
All right, excellent. I want to thank you so much, Dr. Roxanne Mitchell, General Manager, Primary Care Services, TRHA, as well as Sherry-Ann Rollocks-Hackett, Supervisor School Supervisor 3, Division of Education, Innovation and Energy.